Hi, I'm Dr. Salil Khandwala, and we'll talk about now the Urogynecologic Examination. We talked about the importance of the history, but examination is equally important. The typical gynecologic examination is done with the patient lying down, her legs up onto these leg holders. However, this is very inappropriate for a pelvic floor examination. As you can see, this is a 16th century slide where a French surgeon is examining the patient for prolapse in the standing position. So this still exists, and this is the crux of a proper examination. Because standing assesses the effect of gravity. So only in standing you'll see the bulge come out much more and it'll be obvious, including urine leakage. Plus, you can differentiate standing up is, does this patient have a rectal bulge or a small bowel bulge? This is how I classically examine. I have a headlight that I'm looking at the vaginal opening, and I have the patient put a leg up as she's straining down, and she is straining and pushing to see the extent of the bulge or urine leakage. The other position is legs bent up to see if by rotating the pelvis can it be similar. Well, it's not as good, but at least you can try to see somewhat as to how the bulge looks. I'm looking with my light, looking at the vaginal opening. The third way is, especially for rectal prolapse, to have the patient sit on an open commode and have her push as though she is straining at a bowel movement, and you can see the rectal wall falling out as a rectal prolapse. Self-examination also is important. Women are a little concerned to feel there, but once they know what we're talking about and it is safe, then they can feel similarly propped up leg, they're pushing down and they're feeling and seeing what it is, or trying to see with a mirror as to what exactly is coming out. Once, especially they've come to the office and know what it is. The other thing is there can be sometimes a difference. A patient comes and tells me that, oh, it is like a tennis ball coming outside the vagina. And all I'm seeing is a little bit of a small egg. It doesn't match. Well, that could be a different time of day of examination. So what you could do is go home, take a video or a picture of the prolapse, put it in my chart, upload it safely, and we can get it. And that is, it's confidential upload. Rarely would I go on FaceTime, and that's the beauty of technology, but that's usually what we don't do. But this is, I usually hold it for a patient is complaining of bleeding or some issue happening. But for this, I would do it through my chart and upload it, or she can bring it with her. That's why lying down position is the least valuable. Legs bent up, okay, a little bit, but standing up, even though I'm breaking my back and bending down, it is the way to do a proper examination of the pelvic floor. Classically, influence of gravity is most when standing. 40% of women that we saw in our practice did not leak lying down, but when we just had to stand up, they leaked. Similarly, prolapse and type is more obvious standing up, and I'll show you an example. Even the patient will tell the doctor. They'll say, hey, I notice it more standing up than just lying down. So make me stand up. So they'll tell you, make me stand up. So standing assessment of prolapse will show the impact of gravity on all the vaginal walls. And if the standing examination is not done, then the clinical diagnosis may miss prolapse of one of the vaginal walls, and the surgical procedure will fail to address that particular vaginal wall. So that will be an incomplete or a failed operation. Let's see how it happens. So here you have a patient, who has, this is again the normal anatomy. The bladder is here, the urethra, the vagina, the uterus at the back, and the rectum behind it. So front, back, top, down. Now she's lying down, and we do this exam, and you can see the bladder is coming outside as she's laying down. Now we have her stand up. Look at the difference, this versus this. See, the uterus is coming right to the opening when she's standing up. The rectum is falling out much more. So bladder is falling out much more. So bladder is falling out, the uterus is falling out, and the back wall. If this is all that I'd seen, I would just repair the vaginal wall in the front, maybe the back wall, but then the uterus would have come down from the top and you would have missed it. That is why it is so important to do the examination in the standing position. It's invaluable. It's difficult for the patient, it looks awkward. It's difficult for me as I'm bending down with my light, but what would you want? Would you want a wrong diagnosis and then a wrong treatment? or an awkwardness for the patient, a little embarrassing for the patient, awkwardness and discomfort for the surgeon, but making the correct diagnosis. Next, we'll talk about what is the importance of these urogynecologic testing. The patient said, I never leaked before, but after I had my prolapse corrected, I leak all the time. What happened, doctor? Well, we will prevent that, and we prevent that by doing this particular test. So we'll talk about that next.